Today we have Anthony Quinn. He is a 58-year-old male who comes in today with a chief complaint that he has been experiencing spells of confusion and that his family is worried about him. He states that over the past few days he has been experiencing these periods of confusion, that they usually last a few hours, but sometimes they do last longer. He states that they're usually worse in the evening, especially when he is tired. He states that they have made him feel less confident and worried about his health. Anthony has no allergies. He is currently taking atenolol, 50 milligrams daily for hypertension. The other medical history that he has is a vasectomy at 36 years of age. No other chronic illnesses or major traumas or hospitalizations, and the only surgery he's had is for his vasectomy. Both of his parents are alive and well. His mother has hypertension and his father has diabetes. Anthony has a bachelor's degree from North Dakota State University. He owns at Ace Hardware store and works 50 hours a week. He is married to his wonderful wife, Lisa, for 31 years with 3 beautiful kids, Sarah, Michael, and Josh. He denies any tobacco use or recreational drugs and does drink an occasional beer with dinner on the weekends. Upon his review of systems, he complains only about nocturia 3 to 4 times a night, and he does wear corrective lenses, but denies everything else. Objectively, he weighs 215 pounds. He's normothermic. Blood pressure is 150/78. Pulse is 80. Respirations are even, non-labored. He is well appearing, alert and oriented, normal mood and affect, ambulates without difficulty. Appropriate color for ethnicity. Cardiovascular wise, regular rate and rhythm, no extra sounds, rubs or murmurs, refills 2 seconds, pulses 2+ throughout with no edema. Respiratory, symmetrical chest wall movement, respirations are regular and easy, lungs clear bilaterally to auscultation. GI, there's no abnormal findings, soft and symmetrical, non-tender, no guarding, noted no masses, and no visible lesions or scars. Patient denies any genitourinary issues. He denies any swelling, erythema, or tenderness. He is alert and oriented on exam, but he does note some intermittent confusion lately. For diagnostic tests, we're going to get a 24-hour urine albumin, and it was normal. We're going to get a UA, which was abnormal. It showed some white blood cells, trace protein, few bacteria. We're going to get a CMP, which showed elevated potassium at 4.8, elevated BUN at 17, and elevated creatinine at 3.2, and a CBC that showed an elevated white blood cell count at 13.5, and an elevated MCV at 72. So for Anthony, I would say we would diagnose him with an acute kidney injury, since these symptoms have been over the past few days. UTIs are one of the causes that can damage your kidneys, that need to be addressed promptly to prevent further kidney damage. So while his UA shows few bacteria, this could be the cause of his elevated BUN and creatinine levels. So we would need to send him for a follow-up into the ER to possibly see nephrology, where he can be treated medically with fluid resuscitation, diuretics, and for them to be able to discontinue any nephrotoxic medications.